And I would like also now to invite Efrat Carmi, the head of IsrALS. I have to say a few very warm words about IsrALS. The Prize for Life works at a more scientific level, international level, which is really great for the field. IsrALS initiated the treatment or having a change in the attitude of the scientists here in Israel towards ALS. I myself was really drawn into the field by these people who, it was initiated by a patient actually, who invested a lot in that. And they have two functions. One of them, which is kept from the beginning, is to support science, good science, and projects in ALS research. But we know now that this is very challenging. It's not only costly, but the efforts are huge and not very effective until now. But the other thing is that they formed a place, a home for the patients. And the patients now, I am reading the magazine every month or so, and I am really amazed on how much support and how much...
You don't leave me anything to talk now.
Okay. I just wanted to say in the end that Efrat is the real living spirit of this organization, and I really welcome you.
Thank you, Nava. And thank you for the organizers for inviting me. And when I got the invitation, I really thought about what I want to say today. And I wanted to use this platform to have a little bit of a non-scientific talk. I know you're all into science, but there's another side for ALS other than the science, and these are the patients. And today, for being the ALS Global Day, I thought I'll take a few minutes from your time to talk about the other side. As Nava said, we are driving the field in Israel to find a cure for ALS for the last 10 years. IsrALS was established 10 years ago with one purpose, to find a cure. And since then, we've driven a revolution in Israel, investing over $3 million in science, and actually all the previous speakers here were funded by us, and Nava and Ilana and everyone in this field. But 4 years into the activity of Israel, as the scientific activity, we took a very strategic decision that there is a community of patients in Israel, and they are about 600 or 700 in Israel, and this number stays kind of stable because there are about 120 to 150 newly diagnosed patients each year, and unfortunately the same number of patients are, we have to say goodbye to them at that number. And those patients live here and now, and most of them won't see the cure since the disease is limiting their life expectancy. And the disease brings with it a lot of challenges, and we can help them cope with them during the years of their disease. So we have established a patient care department that started with one social worker. Today we have 4 of them, and I will tell you more about our activities. But the main issue and the main goal of our activity is improving the quality of life of the patients. Unfortunately, as you all know, we don't have a cure. And you are all working very hard in your labs, and you see rats, and you see cells, and you see machines and microscopes, and all those things that I'm sure, and if I wasn't sure, I weren't here today, you will find the cure. But by then, till then, and it connects to the next talk that Shai will give. Shai is talking about communication as the recent cure, and I'm talking about quality of life. We have to improve quality of life in the time being of those patients. And I'm a member of the board of the International Alliance of ALS organizations, and this is the trend now. We're all talking quality of life because this is what we have to work for those patients right now. So I just want to give you a few examples of services that we have established, unique services for this community to work on the quality of life. The first one is called the newly diagnosed patients program. Every patient that gets the diagnosis, which is very devastating, as you can all imagine, and what wishes to get our services, gets a home visit of our social worker with all the current relevant information about the disease and about the services they can get. With the diagnosis comes a huge chaos. The sky falls on their heads. And when a social worker comes into the house and knows the disease, the duration of the disease, and slowly, step by step, walks the family through those stages, suddenly the chaos feeling is a little bit more organized, and that's very important. To me, it's one of the major services we've started a few years ago, but now this year it's expanding very fastly. It's the assistive technology service. The story about that began when I'm in this organization for 8 years now. And when I came, I used to travel and visit some homes and caring home facilities of where ALS patients reside. And I came to a very, very good, I have nothing bad to say about this home, but in Jerusalem, a big institution that they had about 10 ALS patients living there. And I came to the nurse, the head nurse, and I said, "Do you have ALS patients here?" So she said, "Yes, they are there, but they are not with us." I said, "What do you mean they are not with us?" "They're not communicating. They just lie there and no one communicates with them." And we told her, you know that they communicate with their eyes, their cognition is fully intact and you can talk to them? She says, no one told me that. And with very low-tech equipment, which is a plastic board with some letters, suddenly those patients that weren't with us came back to life and started to communicate. So then I went to the board and we talked about it and we said no ALS patients in Israel will not be heard because the lack of knowledge or the lack of awareness or the lack of equipment. And since then we have now 4 occupational therapists that specialize in technology. And IsrALS sponsor visits of those professionals into the homes of the patients or their workplace, whatever they prefer, to find them and recommend them the right equipment for them to communicate with every stage of the disease. It can be in the beginning the special mouse that has a little bit different clickers, and it can go into a head mouse, and it can go into an eye tracker. As you will see today, Shai, in the advanced stages of the disease can communicate, and in every stage of the disease we find the solution. And as I said before, this service expanded this year tremendously because after a fight we had for a few years, we managed to make the government put all the assistive technology equipment into the Sal HaBriut, whatever they called in English. I don't think there's an English equivalent. And the state, the government funds now all the equipment, so our professionals go into the homes, recommend the equipment, and what was happening before this year, people had to go and buy it, so sometimes they weren't using it because they didn't have the money. Today the government is paying for that, so more patients are staying in communication with their loved ones and can continue and express themselves during the disease all the way to the end, the latest stages of it. Another very important program, and it's a new one that we have, we say there are about 600 to 700 patients in Israel. In our registry, we have a little bit above 450 patients that we know personally. And the question is, where are the rest of them? And the rest of them are mainly in the Arab sector, where the awareness is way lower. Those patients are being kept at home, either because of shame of the family or not referring them to experts or neurologists, or many, many reasons. I've been learning these subjects for 2 years now. I know exactly, there are a list of 10 reasons why we don't know them, but now we have hired an Arab social worker, and we are opening an Arab clinic in the hospital of Ziv in Tzfat with an Arab neurologist, which will have a whole staff Arab-speaking to the benefit of this population. I'm sure it will make a difference. We started knowing 15 Arab patients. I estimate there is about 100 of them. We're now up to 35. We know them, and I'm sure in 2 or 3 years we'll know more and more about them. The last program I wanted to mention, it's also a new one. ALS is a disease that affects the entire family. It's right that you have one patient at home, but the spouse, the kids, the friends, everyone is being sucked into this reality of taking care of the patients. And one population we found is paying a very high price because of the disease are the kids of the patients. We're talking kids from young children till the age of 18. And after my staff of social workers been educated about this subject, we started a program for the kids of the patients and parental guidance for parents that don't know how to talk about the disease, what to tell the kids, when, how, what words to use. It's very problematic if you think about it, how to communicate such a disease to 5-year-olds, to teenagers, to other kids. So this is something we're specializing in now, and the next step will be support groups for those kids. I'll mention in one more word that we have support groups for spouses of patients, for family members of patients, and we're working very hard to develop any service that we find from the field that is relevant to this disease and is not getting any answer from the community. That's it. We are here for them, and we will continue till the cure is found. Thank you.